is Jason Kevin Earnshaw. I am the dental surgeon, the senior dental surgeon for the clinic group based here at Eswatini Clinic. I kind of accidentally fell into dental surgery. My first passion was in zoology, and I was actually going to do a master's in that, but then that didn't work out. And so I got into dentistry. Most common dental problem would be holes in the teeth, caries, dental caries. So we do fillings for those. But then other issues that patients have would be like bleeding gums or stains on the teeth, broken teeth, missing teeth, and of course the toothache. But then there's other conditions that affect not just the teeth, but the tongue, the cheeks, the soft tissue. Those must also be treated. According to the literature, dental checkups should be at least every 12 months. But I kind of differ from that view. I have a few other colleagues who share the same sentiment, that once a year is fine if you have no dental problems. If you've never had a filling, you've never had a tooth taken out, then once a year is fine, you go for a cleaning once a year. But for the majority of people who have had some minor work done in their mouth, they need to be at the dentist twice a year, every 6 months. And then the third group would be the people with compromised immunity. So patients who have uncontrolled diabetes, patients who have a cancer that affects immunity, treatment for cancer, treatment for autoimmune conditions that lowers immunity, and of course HIV. So for those patients, I like to see them every 3 months until the problems in the mouth are settled. I've had patients walk into the clinic who are dressed in very expensive clothes, they've done their nails, they've done their hair, they're wearing expensive handbags, carry an expensive phone, and they open the mouth and everything's rotten. So they look after themselves on the outside, but not in the mouth. And the mouth is very important because it is the window into your body. So it's where you speak, where you eat, drink, all these things are important. Your mouth must stay healthy. One of the most common greetings that I get from patients when they walk in is, "I'm sorry, no offense, but I hate dentists." And I always tell them, it's fine, I've heard it many times before. But the initial approach with the patient is important. You need to approach them in a manner that makes them comfortable, calms them down. And for most patients, you can talk them through the process and they'll be fine with it. Some patients have heightened anxiety and they can't help it. So for those patients, we give them medication that lowers the anxiety. So something like alprazolam, for example. I've had to do that for a few patients, especially ones who will undergo minor surgery in the mouth. They get very nervous about it. So you give them medication, it calms them down, you're able to operate. And then the patients with extreme anxiety, the ones who can't sit in the chair, we take them to theatre and we do the dental work there. Teeth are not complicated. As long as you brush your teeth twice a day, as long as you floss, as long as you use the correct toothpaste, so that's a fluoridated toothpaste, as long as you use the correct toothbrush, hard, bad, soft, good. And as long as you visit the dentist twice a year, and you're also using the correct technique when you're brushing. So all those things, do that and you'll never have problems with your teeth. They're not complicated. One misconception people have about the way that holes in teeth form is that the bacteria eat the teeth. That's not what happens. Your outer layer of the tooth, the enamel, is the hardest thing in the body. There's nothing that's going to eat through that. What happens is you chew on food, sugary foods especially, the ones that are highly carcinogenic or have high glycemic index. So cakes, sweets, and all that stuff. You chew on food and bits and pieces of that food get stuck in the crevices that your teeth have because they're naturally not uniform shaped. They get stuck inside. And then there's a bacterium called Lactobacillus acidophilus, which eats that food, produces lactic acid, and the lactic acid then starts eating through the enamel. Once it's through the enamel, which is the hardest layer, and into the dentine, which is the second layer that makes up the majority of the tooth, then other bacteria get incorporated into it. A few weeks ago, I was invited to attend some workshops and some conferences in Switzerland by a colleague, a friend. And one of the things that we studied there was dental implantology. So Clinic Group is now going to be introducing dental implants here at Eswatini Clinic, and that will put us more in line with what's offered across the board in South Africa. Well, cosmetic dentistry is an essential part of dentistry. When you are speaking to another person, you look them in the eye, you look at the mouth, right? And you will notice the teeth. Things that people notice from the beginning are the eyes and the teeth. So if a person has bad teeth, that makes them self-conscious and they don't speak confidently, they don't want to speak, right? So if you can improve the smile, whether it's just simply change the color of the teeth, fixing any holes, replacing teeth, all these, cosmetic dentistry, most people think would just apply to tooth jewelry and tooth whitening. There's a lot more to it than that, but it's basically to get the patient the perfect smile. Once the patient has the perfect smile, you'll see that confidence run through the body and just emanate out when they're speaking to people. There are a wide variety of possible emergencies in dentistry, whether it's trauma or it's infection. Even a toothache counts as an emergency. But essentially here, we have all the facilities that are required. If it's trauma, we can go to theatre. We have surgeons that are capable of doing the work. I assist with that work as well sometimes. If it is a toothache, which might not sound that big a deal, but to the person feeling it, it is an emergency. With a toothache, we can treat, we can remove the tooth, we can remove the source of the pain in the tooth, which is a root canal. The important thing to get across to the patient is that frequency is important, so you have to brush your teeth twice a day. Technique is important, you have to use the correct technique. And implements are important, so your consumables, your toothbrush, your toothpaste. But essentially, most patients have a rough idea of what they need to do, they're just not doing it quite correctly. And most patients don't floss. Flossing is quite important, so I have to reinforce that with patients. That if you don't brush your teeth will rot where you can see. But if you don't floss, they rot where you can't see. And that's in between the teeth, and that tends to be worse than just rotting on the tooth. Dental care can definitely prevent other health issues. The literature shows, and studies have shown, that bacteria that you find in the mouth that are causing your periodontal disease, which is an infection of the gums and the bones around, gingivitis for example, those bacteria are found at the sclerotic plaques, meaning that they actually contribute to heart disease and they contribute to heart attacks and strokes. And then another finding, also linked to similar or the same bacteria, is in pregnant women. So pregnant women who have unhealthy mouths had a higher risk for premature labor, for lower than expected birth weight in the child. So it can definitely affect other parts of the body. Another condition that is strongly tied to dentistry is diabetes. So for controlling your diabetes, one very good way to control is just through diet. And if you do not have a healthy mouth, you are limited in what you can eat. And so you are limited in what you can do to control your diabetes. I had a patient a few years back. On a Sunday evening, I get a phone call from a lady, and she says to me that her brother is in a lot of pain. He's had a toothache for the last few days, and his face is swollen on the side. This is Sunday late in the evening, like maybe 9 o'clock, 10 o'clock at night. And I said to her, okay, no problem. I will see to him first thing in the morning. And then she says to me, no, he needs to see you now. And I said, okay, but I'm at home. And she says, well, can I bring him to your home then? I said, well, no, go to the hospital. There will be a doctor on call. They will stabilize him, make sure that he's okay. And then I will see to him in the morning. When I went to see him in the morning, this gentleman he was immunocompromised. Right, and you could see it in his appearance, but he was very swollen all the way along his face and down his neck, and it was all full of pus. So what I did for him was I made incisions in several places and I drained it. The reason why it's memorable is because that is the strongest smelling thing I've ever come across. It smelled really bad, right? But every day for a week, I would go in and I would drain it was blood clots, it was dirty blood. It was pus, it was liquid coming out. Kept draining him for a week, once a day over the course of a week. And after a week, he was back to health and he was fine. He actually offered me a goat as thanks. When I was in public health, I often used to hear patients saying, I'd pull a tooth out and they'd say to me, where's the worm? Boom. Right? They'd always be asking for that. And I was confused. I didn't understand what they meant. So I asked my assistant and she said that there's a belief that the reason why you have a toothache is because there's a worm eating through your tooth. Couldn't understand where that came from. Until one day I was doing a root canal on a patient and I pulled out the neurovascular bundle, so the nerve and the blood vessels from the inside of the tooth. And it comes out looking like a small worm. And I thought, oh, this is probably it then. So sometimes when I remove the nerve from the tooth and it comes out in one piece, so it kind of looks like a worm, show it to the patient, my assistant will say, there's your worm. At Clinic Group, every procedure is personalized for the patients. The worst thing you can do as a doctor is approach the patient based on just the disease, right? A patient is more than their disease, they are a person, right? Every single patient is unique in their personality, in their temperament, in their health, in the progression of the disease itself. So you need to approach all these things, and together, all those things together in one package is unique, specific to that patient. In Eswatini, we offer most of what patients would need for dental care. But we're not quite in line with our neighbors in South Africa. That's why patients have to travel across the border to get specialized treatment done. That's not because we don't have the personnel. We just simply haven't pushed ourselves far enough with the equipment and the training. But we have extremely capable dentists in the country who can do all these treatments that are often across the border. Don't be afraid of visiting the dentist. It is important to fix your teeth. And the unfortunate thing about dental problems is that they usually don't get better, they get worse, right? The pain increases, the amount of work needed to treat you increases, the complexity of the work that's needed to treat you increases as well. Most patients are afraid of experiencing dental pain, the injection, for example, because the unfortunate thing about teeth is that they can only feel pain. So if I'm going to work on a tooth, I need to numb you in order to be able to work on it, right? So I do have to give you that injection to make you numb. But there are techniques, I have my own technique for administering painless injections. My name is Jason Kevin Earnshaw, and I am the Senior Dental Surgeon for the clinic group based here at Mbabane Clinic.